hormonal mechanisms for stimulating aldosterone. Okay, ACTH can stimulate aldosterone and does, but there are other more potent stimulators of it. Okay, and then the sympathetic nervous system directly stimulates the adrenal medulla to release epinephrine. All right, so let's take a look at that. This looks like it might be good. Okay, so here is the adrenal gland slide, and the first thing we're going to do is notice the clear difference between medullary tissue here and cortical tissue. It's usually a very distinct line where you can see the difference between them. If you look down in the medulla, you will see very large spaces because it's heavily vascularized, the medulla is. The cortex is not as well vascularized because the steroids, of course, are lipid soluble and can just easily diffuse out. All right, so let's use higher magnification to try to identify some of the layers. So we're going to the outside, the cortex, or the capsule. There's the connective tissue capsule of the adrenal gland. And just beneath it, we see these little circular, or roughly globular circular clusters of cells. This is the zona glomerulosa, where aldosterone is produced. As we move down, we see the cells start to line up in roughly vertical rows. There's a nice one there. Nice one. This is the zona fasciculata. And if we get right up next to the medulla, notice the boundary at the bottom, you can see this is kind of an open web. It looks like a web or a network. This is the zona reticularis. The way, because this slide was the way it was cut, this reticularis looks quite thick, but usually it's thinner than the fasciculata. And the boundary between them is not very distinct. You can kind of see it right there. This is reticularis down here, that's fasciculata up there. Okay, so that's probably the most subtle. And there we can see those large chromaffin cells in the medulla. That's probably the most subtle histological thing we're looking at here is the difference between the layers of the adrenal cortex. All right, yeah, so that's it for this introduction. If you look in your lab handout, right, it basically tells you to go through these and make sure you can recognize them histologically, find them on models, if you can find them, various models. Okay, so that's what you should spend the rest of the day on, is making sure you can recognize these. Microscopes are back there. Remember the rules, 2 scopes per table. And we've got all the slides up here. Plenty of places where you can find this in our model collection. Any model that shows you this region is going to have some depiction of the thyroid gland. It shows the larynx like this tongue model here. You got half of it there. 2 butterfly-shaped lobes connected by an isthmus, and they're pretty consistent in terms of the tissue. It consists of these follicles, they're called, roughly spherical, though this one's kind of box-shaped here. Massive cells. It's like the crust of cuboidal cells. So this is one follicle, there's a different one, that's a different one, that's a different one. Okay. What happened is, during development, some of the primitive parts of the respiratory system kind of pouched off and sealed and became these little containers lined with epithelium that we call the follicles of the thyroid gland. Okay? Now the center of it contains this material called colloid or thyroglobulin, Basically what it is a bunch of tyrosines stuck together that are going to be the raw material to make thyroid hormone. Okay? These cells, called follicular cells, that surround it, are going to take up iodine out of the bloodstream and concentrate it and store it as thyroglobulin, again, which is a bunch of tyrosines with the iodines added to them. Then we want to make thyroid hormone, these cells will break it down and release it. And now the reason we do this is because iodine, again, needed essentially for this hormone, is a rare element in our diet, at least it traditionally or historically or evolutionarily has been. Nowadays we add iodine to our salt and lots of stuff to make sure that everybody has enough. But in the past you didn't always have access to it. And so what we have evolved to do is to take it up and store it. Right? So when you do have access to it, you'll make this thyroglobulin material, which will then be stored as this thyroglobulin or colloid in the middle of these follicles. Right? So you have plenty when you need it. This is why radioactive iodine is particularly dangerous. One of the short-lived isotopes that are found in nuclear reactors is radioactive iodine. And whenever there's an accident like Chernobyl or Fukushima or something like that, one of the most dangerous elements that's released immediately, unfortunately it doesn't last long, but in the immediate aftermath, because it decays pretty quickly, it's so radioactive. In the immediate aftermath of a disaster like that, you have radioactive iodine around. And so one of the things that you can do to prevent radiation poisoning is to overwhelm your thyroid with normal iodine. So I can remember when Chernobyl happened, it was a few years before the Soviets admitted it and kind of showed reports. And one of the things they showed was little children in Belarus being given these thick red liquid to drink, and it was potassium iodide solution to overwhelm their thyroids with normal non-radioactive iodine so that they would not take up this radioactive stuff. Anyway, that's that. Now, also present in the thyroid gland are parafollicular cells, also called C cells. They're found between the follicles. They're a little larger, have slightly different coloring. And these are the ones that make calcitonin. Right? So totally different hormone, totally different function, but located within the same gland. As you'll see, I'm pointing out where these glands are in the tissues, but really it doesn't matter. I mean, if you could take them and put them somewhere else in your body, as long as they have access to the blood supply, they'll still work the same way. Right? In fact, sometimes when the thyroid gland is removed due to cancer or something like that, the parathyroid, which we'll talk about in a moment, is taken out and implanted like in the armpit or somewhere nearby, and it will continue to function normally. All right, so let's look at that on the chart. Okay, so the TSH, again, from the anterior pituitary, stimulates these follicular cells, and they make the two thyroid hormones, T3 and T4. And those are going to go throughout the body and have their effects. Again, T4 is thyroxine, T3 is triiodothyroxine, only because T4 was discovered first. Okay. Now the parathyroid glands are located in the posterior aspect of the thyroid. There's 4 of them. We've got these little kind of silly charts here. So this is showing you the thyroid, and then there's your parathyroid with its 4 little knobs. Okay. And again, these are going to secrete parathyroid hormone, again, to help regulate calcium levels. There's 2 types of cells in the parathyroid. Most of what you will see, so here you can see an image of thyroid follicles, and there's some parathyroid tissue. Most of them are so-called chief cells. These are the ones that make the thyroid hormone. But you'll also see these little streaks of what are known as oxyphil cells. Okay, a lot of these are named for the sort of stain that they would take up. So I'm not exactly sure what stain they're referring to, but oxyphil is oxygen loving, or perhaps the stain that they put up. You'll see words later on, like we'll have white blood cells named basophils and neutrophils, and this is because of the stain that they like to stain with. But this is the other cell type. Now, chief cells, again, are the ones that make the thyroid hormone, and the oxyphil cells, we don't have any really notion of what their function is. But that is parathyroid, okay? So if we again look at that on the chart, I've shown you here, it's blood calcium level regulating these two things, as we've discussed a number of times. So the thyroid, the parafollicular cells secrete calcitonin, the parathyroid, you've got PTH. All right, so if you look at these on the microscope, here's a slide of thyroid and parathyroid. We'll start over here and look at these thyroid follicles. Very nice. We can see the cuboidal cells surrounding colloid in the middle. Let me get a high power view of that. You can see those. Now, if you find a place where you can see in between them, sorry, I have a hard time focusing. If you can have a hard time, place where you can see kind of in between some follicles, that's a good one. You'll see these larger, lighter cells, like right there. This one has too much thickness to it. You see how that's lighter right there? Lighter nucleus, lighter cytoplasm, that's a parafollicular cell. This slide is too thick, has too much. There's a couple of them together. Yeah, there's some parafollicular cells, they're lighter. Okay. All right, now over here we have a large blood vessel, that's probably the carotid artery. And there's your parathyroid gland. Okay, so all these purple are the chief cells, and this one is the, these are the oxyphil cells. Right, so they're right together. All right, so that is the thyroid and parathyroid. Okay, now we go to the pancreas. As I mentioned in lab today, this is largely an exocrine gland, or lecture today, largely an exocrine gland, but it has these islands of endocrine tissue. And there are a number of types of cells in these islands that make different hormones. We're going to mainly focus on the two main types, alpha cells, which make glucagon, and beta cells, which make insulin. As you can see here, there are other cell types. There's delta cells. It's a lowercase delta. One of these cells which make somatostatin? Yeah, somatostatin. Remember, that's the same thing as growth hormone inhibiting hormone. And then there are these called F cells. If they get tired of using the Greek alphabet, which make a peptide called pancreatic polypeptide. But again, we're going to focus mainly on these two, the alpha cells and the beta cells. Now, I would not expect you to distinguish between them. Fully define the pancreatic islets. So if we go back to our chart, these also kind of sitting off by themselves because they're made like the blood calcium level that regulates the parafollicular cells and the parathyroid chief cells. We've got the pancreatic islet cells being regulated mainly by blood sugar level, blood glucose. So alpha cells secrete glucagon, beta cells secrete insulin. If we look at a slide of the pancreas, it's not real distinct on this one, but you can see it. There's a darker stain here and a lighter stain there. Some of the other slides, the staining is more distinct. This is the regular exocrine tissue, and that's a pancreatic islet in the middle of it. There's another pancreatic islet there, that's regular exocrine tissue. Let's get a little closer. See that distinction, changing the staining coloration. Very distinctive. When you're in here looking at pancreas, take a look around. You'll see some large ducts like that. You may also see, I'll find one of those others. You can also get an opportunity to show you the staining difference. So this one has the HK stain, which this is a dark blue, and so we can see the islets a little bit more distinctly. It's not very big. Yeah, so there's your regular pancreatic tissue, there's your islet. Oh yeah, this is what I want to show you. See that thing? Let's see if I can lower the exposure so you can see a little bit of the layers. That's a Pacinian corpuscle. You may not remember those. I mentioned those briefly at the end of last semester. They detect vibration and touch. And I mentioned that you have some new pancreas, and no one here knows why. We think they're for detecting kind of whole body vibration. That's pretty cool. All right. So that's the extent of histology on the pancreas. Lastly, we come to the most difficult of them, the adrenal glands, which are really 2 glands, or perhaps even 4 glands, depending on how you count it. If we go with 2 glands, the most basic separation is you have the adrenal cortex on the outside and the adrenal medulla on the inside. The adrenal medulla on the inside consists of cells called chromaffin cells. Again, that's based on staining techniques, the name. Chromaffin cells are essentially sympathetic neurons without axons. And as you will learn watching the video, sympathetic neurons release epinephrine and norepinephrine. Mainly norepinephrine. These release epinephrine. That's a difference of one enzyme. Okay? Makes really no practical difference since both epinephrine and norepinephrine have more or less the same effect. Chromaffin cells are, again, neurons without axons. They are stimulated by axons or neurons coming from the spinal cord, which stimulate them to release epinephrine, which then enters the bloodstream and has its effects. Okay? So as we look at this, you will see that the sympathetic nervous system has its effects throughout the body by stimulating the release of norepinephrine or epinephrine. But in addition to that, we've also got this epinephrine released into the bloodstream from the adrenal medulla that has this additive effect, right? So it amplifies it. This is also called adrenaline. Comes from the adrenal medulla. Right? On the outside of that, we have the adrenal cortex. And the adrenal cortex releases a series of steroid hormones that are called, in total, called the corticoids. Oids meaning steroids, corta meaning adrenal cortex. There are 3 layers to this, going from the capsule, the outer part. You've got a connective tissue capsule, and then beneath that you've got a relatively thin layer called the zona glomerulosa. Zona glomerulosa. Zona layer is a region, glomerulosa meaning globular, right? So you have little clusters of cells in circles. You can kind of see it on that slide, but it'll be clear when we look at it in the microscope. Zona glomerulosa cells release mineral corticoids. That's the general name for the hormones they release. Mineral corticoids. Corticoids, steroids from the cortex. Mineral meaning they help regulate mineral levels in the blood, particularly sodium and potassium. Okay. Now the one we're going to talk about, the main one, is aldosterone. Okay. So that's your zona glomerulosa. I'll just draw that again. ZG. Now beneath that is the thickest layer, which is called the zona fasciculata. Now remember, fascicles is like bundles, and in the zona fasciculata you've got cells arranged into long linear lines that look like bundles, bundles of sticks. Again, that's the thickest layer, most prominent layer. And these produce the glucocorticoids. They are named for their ability to mobilize energy or glucose. Right? And the main one there is cortisol, which you may know as the stress steroid. Any of the medicinal steroids we are using to reduce inflammation, like prednisone, are essentially mimicking the effects of cortisol locally. Prednisone or fluticasone. That's what they're doing. All right? And then the deepest layer, right next to the medulla, so this is the medulla down here. The deepest layer is called the zona reticularis. Reticular, you may remember, means like web or network, and that's named that because the cells are kind of going all over the place. And these produce androgens. You might know what an androgen is? Break down the word. What does android mean? Android. You know what oid means, like, right? Cuboid. What does oid mean? Like. Okay? Android means like a man, right? So Data on Star Trek is like a man, he's an android. Technically, if it was a female android, it'd be called a gynoid, right? But I don't think it really makes sense to make an android have a sex. Anyways, I guess you'd call it a humanoid, which is another name for it. Okay? So androgen, gen means maker, like Genesis. Okay? Androgen means man maker. These are male sex steroids, like testosterone or similar molecules. Okay? Everybody makes these in their adrenal cortex, even women. Now, it's not known if it's really significant for males, because the testicles produce a lot more androgens in males than these do, and so the contribution of the zona reticularis may not be significant for males. But in females, it's thought that it is, because the male sex hormones will do things like support libido and muscle mass and bone mass in the female. Okay? In fact, sometimes when there's problems with sex drive that's causing problems in a marriage or something, low sex drive on the part of a female, if it's severe enough and they want to be treated for it, one of the things you can do is give testosterone or similar molecules to try to raise sex drive a bit. You have to be careful, because it will also cause you to start deepening your voice and growing hair in places you didn't grow before. So you have to carefully titrate it, right? But it can support muscle mass and bone mass and libido and those sorts of things. So that is the zona reticularis. Okay, now deep to that, we have the adrenal medulla, the chromaffin cells. Now if we look at this on the chart, I've drawn the 3 layers here. ACTH will stimulate all of it, but its main effect is on the middle part, because that's the biggest part. The main effect of ACTH is to stimulate the release of glucocorticoids. About breast tissue later in the semester, but there are cells, muscular or contractile epithelial cells in the breast tissue that can help push the milk out that way. If the baby suckles, the baby is not actually drawing the milk out with negative pressure so much, though that does contribute to it. It's that suckling action stimulates the release of oxytocin, which causes those cells to help eject the milk. Right? That assists with nursing, especially early on. Right? But anyway, those are the 2 hormones. Now these are both 9 amino acids, so they're called the nonapeptides. And you'll find throughout all the animals that you look at that have hormones that come from the posterior pituitary, they're all 9 amino acids, and they're all very similar, right? So oxytocin and ADH are very similar. They differ only in a few amino acids. Okay? All right. Now, the other part, the anterior pituitary, releases a bunch of hormones into this capillary bed here. If you'll notice, this capillary bed is connected to this one, which wraps around the infundibulum of the pituitary, or near it, within it. This is called a portal system. Now, most of the time, when you have a blood supply, you have arteries that divide into smaller arteries, small arteries. Eventually, you have a capillary bed, and those capillary beds then coalesce into small veins, which then join to larger veins and larger, and then back to the heart. So any blood cell, or if you were taking a journey through that circuit, you would only pass through one bed of capillaries. Okay, that's the normal, typical circulatory pattern. There are a handful of places in your body where that's not the case, where you have a primary plexus, or a first capillary bed, and then you coalesce into a vein, and then that divides again into another capillary bed. Okay? So here we have the primary plexus, which is found up here at the base of the hypothalamus. It's a region called the median eminence of the hypothalamus. Okay? And then we have this secondary plexus, which is found within the anterior pituitary itself. And what's going to happen is a group of hormones that are called the releasing and inhibiting hormones are going to be released again from these secretory cells. But instead of going all the way out the pituitary, they're going to go just to this stalk here and be released into this primary plexus. They will then travel this short distance through this capillary, through this portal vein. This is called the vein that connects the two beds is called a portal vein. And then they will enter this capillary bed where they will then affect the anterior pituitary. Okay? This is called the hypophyseal portal system. Again, hypophyseal refers to the pituitary. So if we look at this in the chart, we can see the releasing and inhibiting hormones produced by the hypothalamus, released at that, released into that primary plexus. Right? We have TRH, that stands for thyrotropin releasing hormone. We've got GHRH, that stands for growth hormone releasing hormone. And then GHIH is growth hormone inhibiting hormone. We've got CRH, stands for corticotropin releasing hormone. GnRH stands for gonadotropin releasing hormone. And then prolactin releasing hormone and prolactin inhibiting hormone. Now there are others. I didn't do an exhaustive list here. Now what these are going to do is travel through that hypophyseal portal system to the anterior pituitary, and then the anterior pituitary is going to release these hormones in response to them. Tropic hormones, as I mentioned, that means stimulation or movement. So thyrotropin releasing hormone. Thyrotropin is another name for thyroid stimulating hormone. So thyrotropin releasing hormone stimulates the release of thyrotropin, aka thyroid stimulating hormone. Growth hormone releasing hormone stimulates the release of growth hormone, and growth hormone inhibiting hormone inhibits the release of growth hormone. Growth hormone inhibiting hormone has another name that we'll see elsewhere. It's called somatostatin. Soma, body, stasis, same. So don't grow, stay the same. Somatostatin. Growth hormone releasing hormone is also called somatomedin. Okay. Corticotropin releasing hormone. That stimulates the release of ACTH, adrenal corticotropic hormone, also simply known as corticotropin. Gonadotropin releasing hormone stimulates the release of these two hormones, which are called the gonadotropins. FSH, follicle stimulating hormone, and LH, luteinizing hormone. Follicles and corpus luteum, these are things found in the ovary. So these are named for their role in the female, but they have effects in both male and female. And we'll see those as we get into the reproductive system. And then prolactin travels to the breast tissue where it stimulates the release of, or stimulates the production of milk. Right? So that is the pituitary gland and how it's controlled. Now if we take a look at it in the microscope, see what this is going to work. Freeze. There we go. All right, so I'm going to slide the pituitary gland here. Yeah, so this slide actually says hypophysis on it. Let's do a little white balance. Okay, so if you look at this, you can see there's two distinct tissues here. This heavily cellular tissue is the anterior pituitary. You can see that you have little groups of cells. These are groups of cells that produce those different hormones, right? So if we were going deeper into this, we would learn about these different cells. They go by different names.